positions of Director of Addiction Services, Director of Business Development, and Director of Clinical Operations for their 110-bed inpatient psychiatric and chemical dependency treatment hospital and outpatient department. Prior to the Ridge, Geoff was Program Director for Hillcrest Hall, a long-term residential adolescent substance abuse treatment program in Mount Sterling, and currently serves as the President of the Kentucky, he served as the President of the Kentucky Adolescent Substance Abuse Consortium for over 10 years and received the Robert Strauss Award for Outstanding Services in the field of substance abuse treatment. In 2008, Geoff was appointed by the Governor Steve Beshear at the time to Kentucky Board of Alcohol and Drug Counselors and served as chair for 10 years. And in 2013 was selected by NASW Kentucky as the Social Worker of the Year. Geoff currently is the president of the Kentucky Association of Addiction Professionals, and we are very pleased to have him with us today.
Appreciate it. And it's such a pleasure for me to be here with you guys today. Can't thank Kathy and Union College and all the sponsors for putting such a needed gathering together of professionals here. And this topic, crisis in Appalachia, addiction, suicide, and other trauma-related issues. As Kathy mentioned, I've been practicing here in Kentucky for about 26 years. I actually started off working in Appalachia. I was employed with Pathways Incorporated, which is based out of Boyd County and Carter County, and I worked in Montgomery County. And even now, treat folks that come to Lexington in my practice that are from Appalachia. So this is a topic that's near and dear to my heart. And what I want to cover with you guys today is just talking about the prevalence of issues that we're seeing, not only in Appalachia, but across the country related to substance use, suicide, and other trauma-related issues. And when we think about that, I'm going to talk to you about deaths of despair, which is what really this is that we're talking about. And what we've seen as far as the increase of that, especially with the COVID pandemic, and now the ramifications of that going forward. And lastly, just spend a little bit of time talking about effective approaches or areas of need and support. I know you guys are going to hear a lot of great presentations this afternoon about that too, but I'd be remiss without touching on some of that as well. So, driving here today from Lexington, I mean, it's just so beautiful. This area is so beautiful. I mean, the trees, everything that I saw coming in, and, you know, treating people from this area, working in this part of the state, you know, you recognize just how beautiful it is. At the same time, this is an area that you guys know has struggled historically for a long period of time. Almost half of the counties in Kentucky are a part of Appalachia. So a large part of our state, it encompasses 13 states overall in the United States. And when you get a sense of how large this area is and the issues that it's been addressing for such a long period of time, you know, up here you look at poverty rates in 1960, and we've actually made a lot of great strides in this area, you know, compared to, you look at the upper right there, 2008, 2012. Unfortunately, this is a part of the country that's gotten much sicker, and the mortality rates have increased pretty significantly. And the COVID pandemic definitely had a negative influence on that. I mean, it's been extremely significant, as you guys have already heard today. But you look at this map of Kentucky here and the counties that are in it, and then I'm going to compare that to this map, which is we have from the DEA. And what I'm showing you here is between 1998 and 2001, where did you want to be in the United States of America to get an opiate prescription? Where did you actually want to be handed a prescription from a prescriber? If you look at that map, and especially 1, 2, and 3, the number one place you want to be in the United States at that time was Johnson, Martins, and parts of Lawrence County, Kentucky, followed by Knott and Leslie counties and Pike County. So, I mean, this was absolutely ground zero for the opiate epidemic. And I'll never forget, it was probably 1996, 97. I had a 17-year-old adolescent in front of me, and it was the first time I heard somebody say he had just traded one of his grandfather's horses for 10 Oxycontins. Everybody was trying, what are Oxycontins? What are these? It was just kind of coming around. That was 1996, 97. And he was from Appalachia. So as you can see, this part of the state and this region has been significantly impacted. And that leads to the ongoing struggle, you know, the areas that are really difficult. Loneliness, isolation, you know, this is a part of the state in this region where there is a lot of isolation. And unfortunately, when you think about mental health issues, depression, anxiety, trauma, it lends itself to that. I've been helping people get into recovery for over 25 years, and it is an isolative illness, very much so. It's isolative for families, it's isolative for kids, and for the person that's struggling with it. And that's where, you know, economists and psychiatrists that call these conditions diseases of despair. And I'm going to talk to you guys a bit more about that, because it wasn't really until about the last maybe 7-8 years that phrase we started to hear more about that. And unfortunately, like I said, the Appalachian area tends to suffer more related to mental illness, substance use disorders. We actually, when you think about the Great Recession going back to December 2007, 2008, we saw a significant increase in suicide and substance use at that period of time. So we're getting into some of the core issues of this: lack of employment, lack of resources, isolation. And these are, again, very isolative illnesses that I think plays a huge role in the increase that we've seen during the pandemic of depression, anxiety, and substance use. You know, I've mentioned how long I've been in the field. The last 2 years have been the highest acuity I've ever seen. And I'm sure you guys can relate to that too. But many of my colleagues were booked out 6, 7, 8 weeks. We've had to hire new people that we can bring in to try to meet the need. Just like I know a lot of treatment centers are trying to expand to meet the need too, which is a good thing. We actually have a couple of economists from Princeton University that were first to kind of coin the phrase deaths of despair. They were actually doing some research looking at U.S. death statistics. And what they noticed is during a certain period of time in our country, we started dying younger. Okay, and specifically, my age cohort was leading the charge with that. And in fact, you know, what they found, lifespans, you know, throughout, because of modern medicine technology, we've been getting older and older and older until the last 3 years. Now, in the first time in our history, we're not. We're dying at a younger age. In fact, middle-aged, non-Hispanic white people, predominantly what they found and reported in December 2015 was the population that were dying at a much faster rate than we ever have. And what's that related to? Depression, suicide, mental health issues. Interestingly enough, and I'm going to talk to you guys a little bit about this, alcohol-related liver disease. Okay. Last year in the United States, we had a 50% increase of individuals getting on a list for a liver transplant. Okay. Why is that? Well, we're going to talk about that here in a little bit, but that's extremely significant. And accidental overdoses. And you know, Hal Rogers touched on that. I'm going to touch on it too. Just a significant increase since the pandemic has occurred. So again, you know, the death rates that have resulted from suicide, drug overdoses, alcoholism have led to that 3-year decline. You know, historically, we've been living longer and longer and longer. And when you start to go back to 2018, 19, that's when it started. You know, so the fact that we lost 2,000 people in Kentucky to overdose last year, you know, is really significant. We've made great progress, you know, in seeing a decrease until the pandemic came and had a significant impact on. And that's why you're hearing more and more people talk about the deaths of despair are actually the epidemic within the pandemic. The epidemic within the pandemic. You know, such a huge increase in depression, anxiety, suicide attempts, people that have taken their life, unfortunately. And you guys see that. I know you see it all the time. You know, lately, it just seems like in the news, you're hearing more and more about people that are struggling and have taken their life, unfortunately. And so we have a long way to go, because, you know, that is one of the most preventable forms of death that we have in our country. So let's kind of take a step back and first look at the substance use of this. So synthetic opioid fatalities rose 38% from 2019 to 2020, about once the pandemic kind of hit. Deaths involving cocaine or methamphetamine mixed with fentanyl, 26% increase, huge increase. I know you guys that work in treatment environments, you've seen this. The number of patients that are presenting with a methamphetamine use disorder, and oftentimes with fentanyl involved, is just at a place we've never seen before. And that increased about 35% outpacing cocaine-related deaths. So, you know, what's playing a huge role in that? Well, the pandemic came, the largest forced isolation we've ever had in our country. We had to do that to try to prevent the spread of COVID. And that had such a significant impact on treatment providers like myself. You know, I remember when our office had to shut down, and all of a sudden here's 32 providers that are going home and providing telehealth, which is, fortunately, we could do that. But a lot of treatment programs, all of a sudden, hey, we can't go to AA meetings, we can't take our patients out, we're having to try to Zoom AA meetings in, big scramble to try to continue services. You know, at one point, about 6-7 months into the COVID pandemic in Kentucky, you could not find an adolescent psychiatric bed in Kentucky. There was none available. In fact, I had colleagues that were referring their adolescent patients as far away as Cleveland, Ohio. And we've never experienced that before. So we're really significant. It's definitely shined a light on issues in providing treatment in substance abuse and mental health, for sure. So here, this kind of shows the significance here. The CDC reported Kentucky saw almost 2,000 fatal overdoses during this 12-month period, September 2019 to 20, compared to 1,304. I mean, we had, for several years in a row, had a decrease, and in Appalachia especially, had seen a decrease. Unfortunately, with the pandemic, all the progress that we made, we've taken several steps backwards. It's starting to look like we're having a positive effect again, you know, especially if things have opened up and we've been able to have more treatment access. But that's one of the ramifications that have come from it, for sure. Overall, about 104, actually, most recently I saw an article last Friday where it's looking like about 108,000 people lost their lives in the last year related to the opiate and methamphetamine overdoses. New data looking at overdose deaths from methamphetamine and psychostimulants has increased pretty significantly, up nearly 36% from the year before, which accounted for about 30% of overdose fatalities in the last 12 months. Pretty significant increase there. This was an article I just saw last week that was Senator Capito from West Virginia and Senator Portman from Ohio talking about basically deaths of despair, the impact of loneliness, isolation. And one of the things I'm going to wrap up talking to you all about that I know we're well aware of is the importance of connection in recovery, the importance of connection related to mental health treatment, related to substance use treatment. And I think that's why the COVID pandemics had such a negative impact, is we were isolated, and we just don't do well when we're isolated, especially when it comes to mental health and substance use disorders. So the increase of fentanyl that's been coming into our country, and you know, the efforts that we're trying to make to address that, we have a long way to go. Okay, I had an article that just popped up last night where they arrested 4 people in California that were outside of a high school that had 15 pounds of fentanyl in their car. Okay, they were parked there because they wanted to find a safe place to park. They just happened to be in a parking lot at a high school. 15 pounds of fentanyl. I mean, it's just amazing how much of it is available right now, unfortunately. So there's the substance piece. Let's talk a little bit about alcohol and the issues that we're having there. It's kind of interesting when the pandemic first hit, okay, and we had to shut down all kinds of businesses. What's one business that stayed open? Okay, liquor stores stayed open, and boy, delivery right to your front door. Okay, I'm practicing in Lexington, Kentucky. I had a client that worked for a liquor store there in town that did delivery, and I'm like, so tell me, you know, how's this impact your business? He said, it's the most money I've ever made in my life. He's like, I make more money on tips than I get in my salary. Okay, and this was right in the heart, you know, first year of the pandemic. Everything was shut down. So what have we seen? Deaths in the United States involving alcohol jumped 25% between 2019 and 2020. Really significant increase. We had almost 79,000 alcohol-related deaths in 2019, up to 99,000 in 2020. 20,000 increase in 1 year, right? And we think about isolation. Okay, alcoholism and isolation go hand in hand. And you know, clients that I'm working with, I started to hear phrases like, I'm day drinking, I'm drinking during the day, I'm drinking to cope with stress, I'm drinking to you know, fill in the blank, depression, anxiety. And the fact that easy access to it, I think it's just really gotten us to a place now that's not good. And what's interesting, the cohort that's had the most significant increase, okay, age 35 to 44, when you think about alcohol-related cirrhosis and liver disease, you don't typically think of 35 to 44, okay? But I have a 39-year-old right now that's in 4-stage cirrhosis, okay, 39. Now, he's been drinking since he was 15, but so, you can kind of see that, but you don't typically think of that, in your head oftentimes, that it's that age cohort. During 2009 to 16, the age 25 to 34 experienced the highest average annual increase. So that started to get a little bit older. Men had twice as many cirrhosis-related deaths and 4 times as many related liver cancer deaths than women. However, women are definitely catching up. There's been a significant increase in women that are reporting drinking and alcohol-related liver disease as well. The states that experienced the fastest rise in cirrhosis and liver cancer, who's number one? Kentucky. We are the number 1 state in the United States for the fastest increase of cirrhosis, okay? Yes, the opiate epidemic, fentanyl, methamphetamine, significant issues. And it makes sense because one-time use oftentimes can result in death. By far, though, still, alcohol-related issues are the most common situation that we're presented with in care. And listen, this gets into primary care, emergency rooms, generalized medicine, but outpatient counseling, inpatient treatment, absolutely. University of Michigan did a study where they looked at the actual number of people put on the U.S. organ transplant list from March 2020 to January 2021. They also looked at the national monthly retail alcohol sales. Okay, is there a correlation? Now, most of us would go, well, yeah. But yes, they found a definite correlation between the two. As alcohol sales went up, cirrhosis reported cases definitely went up too, which kind of makes sense. March 2016 to January 2021, we saw 51,000 more people that were put on a waiting list for a liver, and 32,000 plus liver transplants were performed due to alcohol and hepatitis. Okay, extremely significant increase. And unfortunately, we've come a way with how we assess for this, but we have a long way to go, especially now. The individual that shows up in an emergency room with a head laceration, okay, tell me what happened. Well, I fell off a ladder. Okay, let's treat it. That's not what happened. I was under the influence. I tripped and fell. But there's no questions asked about alcohol use. There's no history taken, nothing whatsoever. That happens all the time. You think of who shows up at a trauma center. Okay, 55% of individuals that show up at a trauma center, they have alcohol in their system. Do they get some type of intervention? Now, we're doing better with things like SBIRT, screening and brief intervention and referral to treatment, but many trauma centers still now in our country don't have that ability to do that. Kentucky, we're at the forefront of that. All of our trauma centers have somebody that will show up typically once that patient either comes out of surgery or they're able to have a conversation that will come in and say, hey, can I ask you a question about your urine screen, your drug screen, and try to give them an intervention. We need more of that. And this is kind of looking at, the prevalence and mortality associated with it. This quote pretty much sums it up right here, that if we don't make steps towards, addressing this issue, we're going to continue to see more and more deaths of despair related to this. Because again, what's alcohol? It's basically a liquid depressant. And for a lot of people that struggle with alcoholism, they have a primary mental health issue, depression or anxiety, that's not being treated. Sales of hard liquor or spirits rose 11% on average in all states in the study. 4 states had substantial increases: Texas, Kentucky, Virginia, and Missouri. So we're kind of at the epicenter of what's been going on with alcohol. We had sustained increases in sales of both spirits and wine during the pandemic, which I know you guys are pretty aware of. So there's substance use, there's alcohol, there's substances. Okay, let's talk a little bit about trauma and how that relates to the Appalachian area. I know many of you all are familiar with adverse childhood experiences in the ACEs study, and traditionally what constitutes adverse childhood experiences. So different types of physical, sexual, emotional abuse, having a parent incarcerated, a parent with untreated mental health issues, all the core issues that typically we see. What's interesting is there's been a lot of research to look at, well, how does that play out even more in the Appalachian region? And I wanted to share a little bit of that with you all, because I think it is important when you're sitting down with a client and you're doing their history, making sure that you're really looking at what is their trauma history. Because oftentimes what leads to somebody to use the substances are trying to cope with what I've experienced in my life. One group in particular, RIU, they expanded those adverse childhood experiences and started to look at some other areas that tend to be more prevalent in this part of the state and also, all of Appalachia. Parent caregiver unemployment, repeated ruptures and attachment were the most prevalent in one study that they did. The death of an attachment figure, okay? I just saw this last week. Due to the COVID pandemic, we lost 400,000 parents. Okay, so think about that for a second. 400,000 parents gone, their children, and the trauma that's come from that. How's that going to play out? It's going to be fascinating to see long term what's going to happen with that. Witnessing an overdose. How many kids in this area across the country have witnessed a parent or a loved one have an overdose and the trauma that comes from that? Repeated ruptures and attachment. Okay, so foster care placements in different treatment environments. Those typically are the ones that have had the most significant impact. And this on the right there, you kind of see that broken down, and some additional adverse childhood experiences that from a trauma standpoint play a huge role in individuals struggling. So I've worked with adolescents my whole career. I love working with teenagers, especially those that have substance use issues and mental health. And right now you are diagnosing me, which is fine. But, at the end of the day, that is a population that has had significant trauma oftentimes, and inevitably when I'm doing assessments, bullying, food insecurity, homelessness, a parent incarcerated, a parent that's overdosed, losing a loved one to suicide or a parent, gang violence, repeated ruptures and multiple divorces. These are the things that can be extremely traumatic for kids. And I think it's important to also understand the connection between those and opiate substance use. I mean, they go hand in hand. All of us in this room, our brain has one thing in common. What is it? Don't forget what makes you feel good. Don't forget what makes you feel good. I know a lot of you because I watched you came in. Where's the coffee? And I did it too. Okay. I mean, that's our brain doing its job. But when you have depression, anxiety, when you've experienced trauma in your life, it works to the nth degree. And unfortunately, with access, there's just so much of it that, we can satisfy that, which is why the rate of addiction is so much higher in this part of the state. And lastly, talking a little bit about suicide, it is the second leading cause of death for ages 10 to 34, second leading cause of death for college age individuals. The pandemic has had such a significant impact on middle school, high school, college age individuals. Man, I've got so many more on my caseload now. That is a cohort that is very social, and to go through 2 years of what they've been through with the pandemic, the impact of that has just been really significant. More teenagers and young adults will die from suicide than from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, flu, and chronic lung disease combined. Yet, which one gets the least amount of funding? Suicide. It's not even close. Okay, and more funding needs to be put toward how we can prevent it. Suicide is the leading cause of death among people with a substance use disorder. We say that again. Suicide is the leading cause of death among people with a substance use disorder. Yes, overdose. And sometimes it's hard to determine, was this an accidental overdose to an opiate, or did this person intend to take their life? But at the same time, with alcohol and other substances, by far, suicide plays a major role in that. Compared to the general population, people treated for alcohol abuse or dependence are at about 10 times greater risk for suicide. So when you have a patient in front of you that has an alcohol use disorder, you have to immediately assume this human being is 10 times greater to take their life. And I have to treat them according to that, or else, I could really miss something. This kind of gives you a sense of suicidal thoughts during the pandemic, what we saw. So all ages, 4.3%, young adults, 10% in 2018. You look at the increase by August 2020, you guys can see how significant it's been in our country and why there's been such a increase in referrals and need for treatment and struggling to find beds and available services. unfortunately. It knows no boundaries, occurs across all ages, economic, social, ethnic boundaries. Females do attempt suicide more often than males, but males are much more successful at it, unfortunately. And you look at the Appalachian region, what plays a role in that? Okay, well, the substance use we talked about, but this is an area of the country too that we're a hunting state. A lot of these states are, which means we have more guns. We have more access to firearms and lethal means, unfortunately. And for this age cohort, 18 to 26, 30, that can sometimes be rash, impulsive, there can be a really negative outcome. And we've just seen more and more of that in the last couple of years for sure. Those with a substance use disorder overall, 6 times more likely to complete suicide. Women who abuse substances are 6 to 9 times higher risk of suicide. I do a lot of supervision, and a couple of folks I supervise work at a women's residential substance abuse program. And I'm talking to them all the time. You have to keep in mind that every one of your patients there is probably one of the most acute people you're going to work with. Their risk of suicide is higher than anybody that you're working with. And you have to understand that and make sure you're talking about how's your mood, how do you feel? Okay, are you taking psychotropic medication? Is that helping? Because the last thing you want is somebody to leave a protective environment and not be prepared to handle the stress that comes from I'm going home. What that's like. 2018, we had 48,344 suicides, which was an increase from 42,000 in 2014. Significant increase. We don't have the data yet from the pandemic to look at the increase that's going to be there, but it's going to be pretty significant, unfortunately. What am I doing? Okay, all right. So you can try to give me the 5 minutes for 5 minutes. Okay, so I'll keep going here. Overall substance use disorder, we've got about 20 million adults walking around with a substance use disorder, 43 million that have a mental health disorder, 8 million plus that have comorbidity. Now here's the thing, I'm sharing statistics with you from SAMHSA. These are statistics of people that actually said, yes, this is me. Think about all the people that we don't have any clue about that are out there struggling. It's much more than this, much more significant. But it gives you an idea of the prevalence of the issue at hand here. And the last thing I'll say on this one is at the bottom there, adults who have an opiate use disorder are 13 times more likely to die by suicide than the general population. Okay, so for all of you all that work with that population, medication-assisted treatment, inpatient, residential detox, know at any given time that person in front of you is probably the highest risk for suicide that you can have. So are we talking about that? And unfortunately, in the Appalachian area, this definitely comes into play. I'm going to shoot forward here just for a second because I want to talk about things that we are focusing on that can be really helpful for this area. A long time, lack of services. We've made huge steps in providing more services in the Appalachian area. We've got a ways to go still, but to meet the needs of the population, the fact that more substance abuse programs are opening up, there's greater access with Medicaid or for the indigent population that can't afford private treatment, but we have a ways to go still. I've seen a huge increase of the ability to knock through a barrier, which is transportation. So now we have programs that will go and pick people up. You all know if somebody says, I'm ready to go to treatment, how much time do you have to actually get them to treatment at that point? An hour, maybe a half hour. I mean, if you don't go right there, so the more steps we can make in cutting down barriers for folks for treatment, that's huge. Medical professionals oftentimes are having to carry the load. So when we think about psychiatric treatment, unfortunately, a lot of general practitioners are having to do that. We've come a ways with more training for physician assistants, psychiatric nurse practitioners, but we're not even close to the need that's there. So that's an area of struggle that we still have. What helps? Resiliency. Resiliency is huge. One of the reasons why I love working with people in recovery for mental health and substance use is the resilient population of people and what they go through to get to the other side of recovery. And there's a lot of different things in the Appalachian area that lend itself to resiliency. And here's a list of some of those things that unfortunately also with the adverse childhood experiences can rupture a lot of these. So any effort we can move towards getting young people involved in different activities, sports, hobbies, community support, It would be great to see a YMCA in every county in Kentucky. I mean, the differences that makes for outlets for kids and families and support, but hopefully we can get there. These are just aspects that I think it's important to keep in mind. Protective factors. I love this quote from Michael Botticelli, who's director of the Braken Center. The vast majority of people I know in recovery often talk about this profound sense of reestablishing, and sometimes for the first time, a connection to a much larger community. Connection. You know, any step we can make towards recovery capital and adding connections for people, mental health and substance use, you know, whether that's sponsors, peer support folks, programs, self-help groups. We've got such a great list of people that are here, sponsors today. So I hope everybody gets a chance to look at their information. That definitely plays a role in this. And you all know the opposite of addiction is connection. Johan Hari has done a lot of great work in this area. I encourage you guys to take a look at some of his stuff. But with the pandemic especially, the increase that we can move toward connection to other people was so significant. You know, so one of the things I talked to a lot of my clients about on the first assessment is what can we do to add connections in your life to help you with your anxiety, your depression, and your substance uses. I know I've got to wrap up and probably take some questions. So I'm going to cut through. You guys have this information, I think. So if anybody, let me get to me here, has any questions, comments, anything you have for me, my email address is up there, jeffwilson914@gmail.com. The last thing I will share, as mentioned, I am the president of Kentucky Association of Addiction Professionals. CAP is the state affiliate of NADAC, the National Association of Addiction Professionals. We're in a point in our field right now where we need as many people certified, credentialed in the field helping. So I strongly encourage you, if you don't join NADAC, to join NADAC. There's a lot of great free training you get, resources. If you join NADAC, you become a member of CAP. So check it out. You can Google NADAC, and hopefully you guys will find some great information there too. So I think I'm out of time. All right. Thank you all very much. I appreciate it.
You got some applications, correct?
Yeah. Questions or? Yeah, if anybody has any questions, I'd be more than happy. Have to. Yeah, please.
There's a lot of great information. Pictures, PowerPoint.
Absolutely. If you shoot me an email right there, be more than happy to share it with you. Yep, absolutely. Yeah, please.
So, your professional opinion, would you consider it legitimate to look at the opiate-related illicit substance overdose deaths combined with the AUD deaths to say, in a general sense, you know, we had 200,000 plus substance use-related deaths during the pandemic?
Well, over the last thing I saw, over 108,000. That came out last week. 108,000. Yeah. And that's, you know, again, what could best be determined at this point. It'll probably continue to pick up as we keep going, you know. But I think eventually, and we're starting to see it now, just month to month, it's starting to go back. And I think a lot of that's because everything's opened back up and we've got access now. And that's made a huge difference. Good question. Other questions you guys have? All right. Thank you all very much.
Thank you, Geoff.